Welcome to the Protecting Your Nest podcast. Protecting your family from premature death requires an understanding of what are the leading causes of death. And as many of you know, heart disease accounts for about 23% of all the deaths that occur in America, but it's closely followed by cancer, accounting for 21.7%. So, that's why I always ask my patients, if they're concerned about longevity, they should consider a coronary artery calcium score test because that'll help them identify calcium plaques, which could lead to heart disease. And that's also why today I want to spend some time talking about cancer, since that's the number two cause of death. But to tee up today's guest, I wanted to briefly review a comparison of normal metabolism of glucose by healthy cells versus the path cancer cells tend to take. So when you imagine glucose being consumed, it goes through a couple of pathways, but one of them initially is anaerobic, and that's called glycolysis. And when you do glycolysis and glucose becomes pyruvate, you're going to net about 2 ATP, which is a form of energy. Now, beyond that, if you take those pyruvates and then there's oxygen around, you can actually go through citric acid cycles and electron transport chains via acetyl-CoA and end up with 34 to 36 ATP. Cancer cells tend to have a less desired path, and they tend to take a path where they take that pyruvate, and instead of going through the citric acid cycle and the electron transport chain, they actually go by way of lactate to yield 2 ATP. Now, this is the interesting thing. They only get 2 ATP versus going down that aerobic pathway. And this tendency to use anaerobic lactate is something called the Warburg effect. I'll probably ask my guest to talk a little bit about that, but that was from a guy in Germany who was a scientist, and of course his name was Warburg. So that's a very interesting concept, and I think it's important that we understand that. And again, I'll let my guests spend a little time talking about that. But one way you can kind of think about this is that if you have a family member who's had cancer, sometimes they get a PET scan. And believe it or not, when they do a PET scan to look for cancer, they use a radioactive tracer made of a special type of glucose to detect cancer, because the glucose goes straight to the cancer. So it tells you a little bit about the idea that cancer loves sugar. And of course, we're low carb fans. So one of the things that we'll benefit from with that dietary approach is that we may have a way to at least make cancer struggle a little bit if we don't eat a lot of glucose or starchy food or sugary food or processed food, and we use fat as part of our fuel source as opposed to glucose. So I just want to kind of tee my guests up with those concepts and introduce her. So my guest today is Miriam Kalamian, and she is a nutrition consultant, educator, and author specializing in implementing a ketogenic diet to help fight cancer. She earned her Master's of Education from Smith College and her Master's of Human Nutrition from Eastern Michigan University. She is board certified in nutrition by the Board for Certification of Nutrition Specialists, and she has extensive knowledge in this area of keto and cancer. And she's also the author of a great book, Keto for Cancer. So with that, I really want to welcome my new friend, Miriam, to Protecting Your Nest. How are you today?
I'm great. Thank you for having me here.
Yeah, well, it was a pleasure to hear you speak at Low Carb USA and actually shake your hand after the presentation. And I knew that we would be spending some time here. In fact, I'll make sure our thumbnail includes that picture that we took together.
Oh, great. Yeah.
Yeah, so they'll see that if they're watching it on the YouTube channel. And of course, some will be listening in the podcast app. So I just want to get my audience a little bit more information about who you are. And the main question most people have is, how in the heck did you get into this area that you're studying? What was the inspiration that led to that?
Well, my son was my inspiration. In 2004, he was just 4 years old, and we were blindsided by this diagnosis of a brain tumor. And like I said, 4 years old, and this tumor was the size of an orange, and it was infiltrated into the normal tissue in his brain, and they had deemed it inoperable. So in 2004, if you went online and looked, it was there was no information about keto, and the information that I could find on this tumor was pretty dire, in that it was so diffuse, inoperable, and in the location that it affected his vision. It affected his processing. It just seemed to, and definitely his hormones. So it impacted so many of his functions, and we just went along with what they said, the standard of care, which was 14 months of basically weekly chemotherapy, little breaks in there. And it didn't do anything to stop the tumor. It may have slowed it, we don't know. But at the end of it, first MRI, post-treatment, it was lit up like a Christmas tree, is the words that they use. So we went from there to another treatment, We did the unthinkable with a surgery, onto a clinical trial. All that sort of failed to control this. And so just as he was turning 7 was when I quite accidentally, and I love telling this part of the story, I accidentally found the ketogenic diet. My son was being put into a palliative protocol. In other words, not really expecting to have any benefit to him as far as the cancer, but maybe it would prolong his life. But it was certainly not going to prolong his quality of life, because it was going to mean hospitalizations and infections and blood transfusions and all of that. And I was online checking one of the drugs in the protocol, and I found some information on it, but I was at my mom's house. She was in her 80s, and her printer was hardly ever used. And so it was just all gummy and jammed up, and I couldn't print this information. So I bookmarked it. This was in 2007, February of 2007. And I went back a few days later to print it out. And now there was a totally different article there. It wasn't this article on the drug. It was Dr. Seyfried's groundbreaking research, calorie-restricted ketogenic diet in a mouse model of glioma, but it had slowed progression. So what was that? Why did it go there? Well, because I was looking at Science Daily. And Science Daily, they were publishing this brand new paper. They were mentioning this brand new paper. So, I took a look at it. I shared it with my husband. I just couldn't believe that anything like this might be beneficial. But it had some science there, and it had references to other work that had been done. And frankly, Dr. Tony, we had nothing to lose at that point. We had zero to lose. He was, definitely heading down the wrong path. And so I brought this to his very fancy oncologist, and this fancy oncologist said, "Oh, the Atkins diet, that's for fat people. Just stick to the plan." And it's like, well, what plan had he offered us? It was this palliative care with a few statistics that just ultimately meant our kid was going to die shortly. So anyway, with the support of our local team, because our local team was great. My son's pediatrician, Rafi's pediatrician, was amazing. And the local oncologist had said basically the same thing. What do you have to lose? So I used the protocol for kids that are put on the diet for epilepsy, which had almost 100 years behind it. So this was, it's like, okay, if you're going to do this, do it with this protocol.
That's right.
And so they knew what to look for as far as biomarkers in the blood, and we knew what to look for, changes in weight and all of that. Well, he started it right after the MRI that got him kicked off of a clinical trial, because we knew that was coming. And 3 months later, he had another MRI. And I was hoping for anything. Maybe it just slowed it down a little bit, whatever, not lit up like a Christmas tree, whatever. And boy, were we just shocked to find out that it had actually 10 to 15% shrinkage it had pulled away from. I know, it was just amazing. And Rafi, in the meantime, was getting a little bit of his vision back that he had lost in his left eye, and he wasn't as stumbly or uncoordinated as he'd been. So everything, quality of life, was moving in the right direction. So of course there was absolutely no reason to stop. He was feeling much better, doing much better. His tumor finally was responding to something. But what I realized was that, okay, so I'm following this protocol. It turned out I was doing it wrong. I was doing the ratio wrong, but
Gotcha.
I was doing the calorie restriction right. And since Rafi was heavy, it didn't matter that he had lost some weight in
Right.
this 3-month period. So when I realized I was doing it wrong, then it's like, well, I need to figure this out. So I spoke to the nutrition consultant for the Charlie Foundation, which is the group that advocates for epilepsy. At the time, it was just epilepsy. And she very generously donated that time to me, about 90-minute call. And at the end of it, it was like, well, I need to learn how to do this. I just need to learn how to do this, not just for my kid, but why in the world aren't other people using this? So that was like June. By July, I was enrolling in the master's program in Eastern Michigan. And by August, I was starting classes. And 2.5 years later, I had my master's in human nutrition. But I was already using all of what I was learning. It was
Right.
like single focus here, laser focus on helping my son during that time. But when I got that degree, then it was like, okay, now I have the education behind me, and now we just got to like build this out with other people. So yeah, that's what I've been doing for the last decade. So 2007 he started, 2010 I got my degree, and now it's 2021.
Yeah.
So and I tell you, this is still, brain cancer is still the area that I feel there's just like, it's almost unequivocal that there's a
Right.
benefit,
Right.
quality of life, but also a benefit in slowing down the progression of the tumor. There are some cancers, and I readily admit that I don't really know.
Yeah.
Um, but if it can improve quality of life for people, it still has a benefit.
And that's what I'm hearing from you. You mentioned vision and, less, maybe dizziness and things like that. But can you think back on some moments? I mean, how much time did he gain? I mean, could you approximate how much time he gained by doing this versus going
Yeah.
to?
Okay. At the time that they were going to move him to the palliative care, the oncologist had told me that he had a 1 in 3 chance of any response. And this was 4 drugs they were going to be pumping into this kid.
Mm,
So he had a 1 in 3 chance of any response, a 1 in 10 chance that the response would hold for 18 months.
mm,
So typically at that point, then it's a couple of months. And
mhm.
so they weren't even looking at the possibility of 2 years at that point.
Right.
And my son lived for 6 years. Unfortunately, and he did. He was 13. He had just turned 13 when he died.
Okay.
So, but in that 6 years, we were able to have some pretty amazing time with him.
That's right.
Mostly good time, although there was, roller
Yeah.
coaster moments where things were crashing down around us. But yeah, 6 years. And that 6 years, he got to grow and develop as a person, and we got to
Right.
be with him. And, I have great, in my presentations, I always share a couple of photos of him. And I have
That's
one of
right.
him on a whale watch and another one with him running on the beach. This was a kid who had foot drag on the
That's
right
right.
side. And now he's running on the beach. So it was, pretty amazing time climbing. I have a video of him climbing a fence. It was unheard of. This kid had
Yeah.
been like, hospice was there, at one point, just a few months prior to that. So
Right.
that's what I mean
Yeah.
about up and downs in that. But yeah, I mean, it just, those
That's a lot
moments,
of
those 6
benefit.
years. Yeah.
That's huge. I mean, even the well thing, I think the first time, I don't know if we were in Alaska, I was with my whole family, and it was one of those areas where the wells kind of just hang out. And you get there and you don't see any wells, and all of a sudden you see wells and you're sitting there with your mouth open, and for you guys to have experienced that together is
Oh
incredible.
God,
So,
a, a whale bring her little baby, her calf, right
oh,
up to we were in a little fishing boat, and she brought him over, and we could actually like lean out, touch it. She was
Oh my
watchful.
goodness.
But my son got to do that. And, kids that live a lot longer lives don't have some of the experiences that,
Right,
that
right.
he had.
And
Yeah.
the quality of
Yeah.
life, even if you're doing, it wouldn't be a therapeutic keto because we're talking about cancer and maybe seizures, but if you're just doing keto in general, your quality of life gets better. Your energy gets better. Your focus gets better. So,
Yeah,
uh,
he dragged us along on that journey.
right,
My
right.
husband was metabolically unhealthy and
At the
had been
time.
for a lifetime.
Wow.
And I was like eating all kinds of stuff and thinking I
Right,
was getting away with it because I wasn't heavy.
right, right,
But
right.
you can be normal weight and metabolically unhealthy. I feel better now than I did in 2007 when we all sort of started down this road. So I went low carb. My husband went strictly ketogenic, and Rafi, of course, was strictly ketogenic.
Absolutely.
And so we all benefited from that. And once you're in this world, what the amazing thing is then you have like Doug and Pam putting on these conferences that is just such an amazing community. It really is.
The
And
food
and
was
I've been what's
remember the
that?
food? The food was
The,
incredible.
the food
Like,
was incredible.
I can
Anybody that
understand why your son could eat it because it was, like, delicious.
And that is, it's like when people say it's unpalatable. I can't think of a single thing at that dinner that was unpalatable.
It
Just
was
wasn't. It
mind-blowing,
was
and we
all
had
good.
dessert. We had dessert every night, and it was all delicious, so, yeah, you're right, it's, so I didn't have to ask the question, "Did he like the food?" Because I already know. My
Yeah,
kids love it, and they're older, they're, college age, but you don't have to fight to eat a keto meal. In
yeah.
fact, I'm kinda smelling some stuff cooking right now. I think we're doing steak tonight, so I'm gonna have to make this a quick interview. So thank you for sharing. One more thing, your family. I know you've had conversations with others about being skeptical or saboteur, sabotaging what you're trying to do. How did the rest of your family deal with this idea that you're going to feed your baby a keto diet to treat cancer?
Oh, they just didn't have any, it didn't make any sense to them because it
Right.
wasn't medical. As a matter of fact, I have a sister who was diagnosed with lung cancer. And when she told me of her diagnosis, then there was a slight pause while I was processing this. And she said, but I'm not going to give up my carbs. So that's where she was at. Apparently, if the carbs provide her with some kind of comfort that she needs, and she's not willing to look beyond that. And that's okay. I don't push this on people, but when my son was when we were first doing this, I can
Hmm.
remember my mom being very upset that she couldn't like make his favorite thing, which was rice pilaf. Whenever we'd go to visit, rice pilaf,
Right.
um, and we were out to dinner. I had slipped out to the bathroom, and I come back, and my sister's given him a piece of bread.
Mm.
And I said, "What are you doing?" And she said, "It's just one piece of bread. That won't hurt
Yeah.
anything." And so, yeah, I do in presentations when I'm doing the advocacy ones, I talk about the friends and family, and they can be your
Right.
most ardent supporters or your worst saboteurs.
That's right.
And my family fell in the middle of that. They weren't either extreme of that,
And they
but
just
that
don't know. They just don't understand
no,
it fully.
no,
Yeah.
my mother saw it as deprivation, and I
Hmm.
don't know what my sister was thinking when she gave them that piece of bread.
Right. Yeah. Yeah. And again, for those who are listening, there's a difference between therapeutic keto. You wouldn't want to have epilepsy or be treating cancer and you're trying to stay in ketosis, which really matters. Now, if you're trying to lose weight, it probably doesn't matter as much, that you're going a little bit out of ketosis. That's a different animal. But if you're really treating it therapeutically, you want to be a little bit more cautious about that because it's really a matter of life and death in that scenario. And
Well,
we don't want people
it really is an epilepsy.
yeah,
Like if
yeah,
you make a
yes,
misstep, you use the wrong sunscreen. In epilepsy, you can end up with a seizure. And I know of one case where a 15-year-old girl
a
died after visiting the
sunscreen.
fair. Yeah, sorbitol in the sunscreen can
Ah,
give some kids a seizure.
that's insane.
Um, yeah, that is crazy. Now
Yeah,
because that was the model we were following, that's all we had was that
right,
diet for
right.
epilepsy. I had the keto diet calculator, which was for kids with epilepsy. It figured out macros to the second decimal place. That's to the 100th of a gram. That's how precise it was.
Wow.
And we followed this for, it was like 2.5 years. And at some point in there, it was finally okay for us to go estimating things, not
Mhm.
recording
Okay.
everything.
Right, right,
We were
right.
going more at that point by what we were seeing on the occasional finger stick. We weren't finger sticking as often. He was using the urine test strips, and kids will continue. The urine test strips will continue to show levels of ketosis. Where in adults, though, that's not very effective. Has to do more with the increased muscle mass in an adult versus a young
Okay,
child.
gotcha. A lot of nuances, which is why it's nice to have skilled clinicians to kind of guide us as we make these changes. So, a question.
Absolutely. There are nuances for cancer that's the thing
Absolutely.
that I work through with
And I
people.
and I think that it's evolving, but we're getting there. So, a quick question about what I talked about as I did the intro. I suggested that cells are not that smart because I mean, who would choose a pathway towards energy that only yields 2 ATP?
Mm.
It doesn't really make sense, right? So when you think about the reasons why cancer cells would choose that pathway, what comes to mind? Why would cancer not be smarter in that regard?
Thank you. Thank you for that question, because I think that's a really a critical question here, because you can think too simplistically about this. You can think, oh, it's cancer cells. Cancer thrives on glucose, or cancer, thrives on sugar, however you want to word it. And that's true, but it's not for just the energy production. So it's not about just those two ATP molecules that it's making. At the
Mhm.
same time that it's doing that, the fermentation in the cytoplasm of the cell is creating a lot of what is referred to as biomass. So that's all the building blocks that you're going to need to build a lipid membrane to
Mhm.
for the cell to create the little microtubules from proteins that are going to be the structural components of the cell. So it's making those materials at the same time as creating this little bit of energy. And in
Mm.
order to do that, cancer cells, they want to survive. So part of their signaling goes, well, we need more glucose, so let's
Mhm.
put more insulin receptors on the cell, and
Right.
we need more glucose transporters to bring it in so that we can use it. And
Okay,
the
cool.
same little transporters that bring in something beneficial like ketones are also able to pump out the acid accumulation in the cell,
Mhm.
because beyond the point of where they're making all these little bits and pieces, the cell's going to get really acidic, and it's
Mhm.
going to overwhelm the cancer cell. So these are little avenues out. And what does that do? That creates inflammation in the
Right, that's
area
right.
around the cell. They call that the microenvironment of the cell,
Mhm.
and that brings on an aberrant immune response, because it's chronic. It's not just going to respond to something and then this problem is going to be fixed. So the immune cells come in and they hybridize with what's going on, and they can spread cancer in other places. That's part of how we get metastases. And that chronic inflammation, of course, raises all kinds of other issues in the body. That's why in the systemic cancers, like breast and pancreatic and colon cancer, all the things that involve you know um, the whole system there, uh, boy, it's hard to calm that inflammation down. But one of the best ways to calm inflammation down, because cancer treatment inflames the body,
Mhm.
but the ketogenic diet, just lowering the carbs, getting basically rid of the sugars and the starches primarily, is the thing that lowers the inflammation in the body. So when people say to me about anti-inflammatory foods, I go, well, I got a better plan. Let's just get rid of the things that are causing the inflammation in the first
Right,
place.
right. Yeah. It's like any supplement. It's a rare supplement that's so effective that it's better than a anti-inflammatory
Yeah,
diet. I mean, it doesn't
I'm
make
with you
sense.
on that.
And if you do that, you probably don't have to take a lot of supplements. So I think that's kind of a win-win. And so that's a very interesting. So cancer's a little smarter than I thought,
Yeah.
right? It's
Well,
actually,
and
yeah.
and over time, when it starts to fail at this, like this system part or whatever gets blocked off. I mean, I showed a slide in my presentation of pancreatic cancer cells. So, you lower the availability, and usually the lower availability of the glucose and the glutamine in pancreatic cancer is coming from the loss of appetite. So quite
Mhm.
typically advanced pancreatic cancer, the person can only take in about 1/4 of what they need in order
Right.
to maintain their weight. So you get this, this uh, this catastrophic catabolism of tissue. And but cancer is the survivor, and what it does is it creates these little like inroads into the cell. Come on, bring it in from the microenvironment. You guys just give up what you got there. If we can't
Mhm.
get it from the blood supply, we're going to bring it in anyway. So it's devious, and it's definitely it's going for survival. That
That's right.
metabolic programming, that they call it
Mhm.
metabolic reprogramming, or sometimes they'll call it metabolic hijacking. It
Mhm.
just keeps evolving. A great book, if you haven't read this one yet, put it on your list. Sam Apple just wrote a book called Ravenous, and it's the
Ravenous.
story of Otto Warburg. And he was
Mm.
quite a character, quite a and not in a good way. He quite the narcissist and arrogance beyond measure. But he did, as you said, he identified, he observed what's called the Warburg effect, and that is that cancer cells can survive and even thrive by
Mhm.
upregulating their fermentation of glucose. And
Right.
I don't think he recognized the whole biomass synthesis thing.
Mhm.
It was an observation on his part. And I
Gotcha.
also want to clear up something on Otto Warburg, because a lot of people think he won the Nobel Prize for that. And he
Mhm.
won a Nobel Prize, but it had nothing to do with that direct observation. But that observation in the 100 years since he found that has not been challenged.
Mm.
It's true. Cancer
Yeah.
cells upregulate their ability to ferment glucose, even in the presence of oxygen. And
Mhm.
Dr. Seyfried goes into detail on the mitochondria being dysfunctional, and they
That's right.
can't really make those 36 ATP molecules, even if they get the pyruvate in there.
That's
And
right.
in the process of doing that, they're firing off, my husband calls
That's
it the Yosemite Sam effect. They're firing off all these electrons, and these electrons are leaking all over the place and creating a lot of reactive oxygen species, that ROS, that increases the inflammation in the cell too.
Well, thank you for continuing to take us to school because
Yeah.
one of the things great about being in a master's program for nutrition is that you get a chance to review. And that's also what gave me the courage to talk about the mitochondria during my presentation at Low Carb USA. And it is amazing what you can figure out and discover if you just have a little basic understanding of how the body works. And so I think that that understanding just guides us to the right answers and the potential solutions. So I've been so fortunate to have that knowledge, and I think about the knowledge that you've acquired not only by going to school, but by having a child that you're trying to help
Oh, yeah.
through this process and just help him extend his life as much as possible.
Oh,
So
and I could have done such a better job of it
yeah,
if I knew then what I know
well,
now. If
right. I mean,
there
but
was no community of people
there's
supporting
nothing,
that.
right,
Yeah.
and that's why this type of podcast, Low Carb USA, Society of Metabolic Health Practitioners, all of this is gonna be, vital, and, so you have more information now, so how do you evaluate a patient to determine if they're a good candidate? I'm assuming that everybody is not a good candidate. Maybe that's so
Yeah,
what's your thoughts? Do you have a process or a way of
I
thinking
do.
through
Yeah.
this?
Yeah. First of all, there's a couple of cancers that I probably am not going to work with people
Mhm,
to go for therapeutic keto.
mhm,
And it's the blood cancers I'm not so certain about. Lymphoma, yeah, definitely lymphoma is one I'll work with, but I'm not
mhm,
really sure, what to do with something like AML if somebody is scheduled for like a stem cell transplantation. So I don't want to interfere with that process. When they're
mm,
on the other side, they certainly can go low carb or ketogenic, if they're healthy enough for it.
mhm,
But during that process, I don't think that keto is compatible with
right,
that process.
okay,
Um, So, it involves a lot of dexamethasone, and dexamethasone really affects the ability to stay in ketosis.
Yeah.
So I don't know if there's any, benefit to doing it at that point. And there are a few cancers that I'm kind of wary of, the ones with the BRAF V600E
Mhm.
mutation. I'm a little wary about, just from a mouse model study, not from anything in humans. But it was like more robust than a cell study. It was
Okay.
a mouse model. But again, they used like, it was a, one type of cell, this mutant cell that they use to, in this mouse model. And so, of course, that can have more potential to
Okay.
progress. And they infuse the ketone body into the mouse rather than having it be it wasn't making its own ketones. I have an intake, and I think it's really important. I look at the whole picture, the demographics of the person I'm working with. So the age, height, weight, their medical history. I need to know if they're what drugs they're on, what medications they need, what their conditions are. And one of the things that's really important, of course, is weight.
Mhm.
So
Right.
if somebody's newly diagnosed, chances are very good that they're
Mhm.
overweight, because
That's
if
right.
you look at the stats, where about 70% of the people are going to be, adults are going to be overweight
That's right.
or obese. And so chances are good that they have a cancer, they're overweight. And also, that has raised their risk of getting a cancer as well. There's like colon cancer, breast cancer, those who are overweight or obese that are higher risk for developing a cancer in the first place. So I look at this information, but let's say somebody was diagnosed 5-6 years ago. Now it's metastatic. The treatments haven't been successful, or only successful for a period of time, and now they're dealing with this again. And quite often, I mean, we all know people were wasting away at the
Mhm.
end of their lives from the cancer that they had. That's not a good time to start keto.
Right. No doubt. That's
When
right.
when you are underweight and malnourished, when people come to me telling me, oh, I need to I need to gain 10 or 12 pounds, and I look at that and I go, keto's not a weight gain diet. There's
No, it's not.
nothing about keto
No.
that's going to support that. If
Mhm.
you are weightlifting, you can gain muscle on keto.
Right.
But if you have a stage 4, cancer, and you're at the end of your life, the chances are very good that you're not weightlifting. So you're just taking in, or trying to take in, this enormous amount of fat because you're trying to gain weight, and that's never, ever, ever successful. So I do think there's value in everybody cutting out uh, the the sugars and the refined starches.
That's right.
But if you're at that point, just clean up the diet and eat what you can and what you want from, the lower, the good, healthy, the foods that we all support in our low carb world to start with, and not count the carbs, not, eat as much protein as you
That's
can.
right.
And just, hopefully, again, quality of life, if you can do those things. But
Okay.
it's very, very sad to me. And I'm glad to see that there's some research out there right now. Dr. D'Agostino's lab is looking at the effect of not necessarily keto, because, like I said, it's got some problems in late stage cancer, but they're looking at the possibility of using ketone supplementation to protect
Mhm.
the
Right.
muscle tissue. And that's what,
Right.
the cancer is catabolizing this so that it can use the amino acids that are in it, so
That's
that
right.
it can use the oxidation of fats to it. It just takes the body down. It is an inflammatory cascade. So
Mhm. I
the
hear you.
whole thing of the cytokines with COVID-19.
That's
Similar
right.
thing is going on in somebody who has cachexia, which is that wasting disease.
That's right.
Yeah.
Absolutely. This is helpful. My hope was that this episode would speak to a person who's, thinking about cancer, and a family member, maybe they're dealing with it themselves, and to maybe provide some hope that there's a path other than conventional medicine. And I should say that differently. In addition to
In
conventional
addition to,
medicine,
as an
right?
adjunct to. Uh-huh.
Exactly. I want
Uh-huh.
to be very clear. We're not trying to, say keto cures anything. We're saying
Absolutely
that
not.
if you do these things together, you will optimize your chances of being able to fight it. And I think these types of questions are the things I would want to ask if I was concerned about it. And another question I would ask, if I had, most of our patients suffer from a lot of other health conditions, and I'm wondering if there's other medical conditions that create challenges for a keto for cancer treatment, or do you have anything you say I can't use it in this situation, other than
Mm.
this, you gave examples of cancers that may not respond, or there are other medical conditions that we need to worry about?
Yeah, if somebody comes to me and they are on insulin for diabetes, I'm not the person to manage their medications. They
Yeah.
need to be working with their diabetes, low carb diabetes person
Hmm.
that's looking at if they're not capable of understanding how to adjust that, they really need the help from their medical team, and then I'll work on the diet part of it. But that's one. Uh, things like high blood pressure almost all the time are improved. People
Hmm.
come with, thyroid. Probably 2/3 of the people I work with have been diagnosed with a thyroid condition, whether it's Hashimoto's or low thyroid or whatever it's called. And so I'm thinking there's more than just an association there. But that is okay. Like we discussed about gout, gallbladder. If they don't have a gallbladder, it's still okay. You could do keto. But there's like things that have like caused structural changes. Like there's something called the Whipple, the Whipple procedure.
That's right.
It's removing part of the stomach and part of the intestine and head of the pancreas, tail of,
Hmm.
I think it's the head of the pancreas.
Hmm.
And it's just like a rerouting of the plumbing there, and
Hmm.
they need somebody to, if it's new, they need somebody to help them with
Yeah.
that adjustment. Feeding tubes, they're really okay. My son was on a feeding tube at 2 different points in
Hmm.
his journey there. And so, I know how to work around the feeding tube thing.
Right. That's right.
Um, and, other comorbidities are mostly that the population that I work with are older.
Right.
So they're older and they have that comorbidity of aging. And so things aren't working the way they used to. The gut's not working the way that it
That's
would
right.
have 30 years before. So gut issues, irritable bowel, uh, bowel obstruction. That's a big one. Ovarian cancer quite often, or colon cancer quite
Hmm.
often. Not, I shouldn't say quite often. The people that are most likely in my work to have the bowel obstruction problem are
Hmm.
people with a history of bowel or ovarian cancer.
Gotcha.
Yeah.
Gotcha.
So, yeah, those are, I'm sure I could think of about 100 more. I think I
Yeah.
had, Dr. Tony, did I have like 5 slides on that, on
Yeah,
relative
you definitely, yeah,
contraindications?
during the
Yeah.
conference, yeah. So there's a lot, and I think why this is an important question is because we don't want to blanket say, okay, people walk away from these conversations and they just dive into deep water. But why do we have clinicians that go to school and learn stuff? Because they need to be thinking about stuff you're not thinking about, so you can make a educated decision about the best path moving forward. So that's why I'm trying to think like a patient would think in terms of what they need to be thinking about, what
Yeah.
they need to ask about. And I also think about what we talked about earlier, potential complications. We already talked about, gout, how we have to maybe ease into this treatment if we have a history of gout. Are there other conditions that we may want to ease into this, or,
Yeah.
things that
Yeah.
could be an issue? Anything else that comes to mind?
Yeah, if the weight is borderline, I don't really want them to jump into ketosis.
Yeah,
And if they're older, I don't really want them to
right.
do like
To
starting
jump
from
too
a
quick.
fast or something like that.
Okay.
Yeah, there's three
What
ways
about
to.
kidney stones? I just thought about that. What about kidney stones? Is that
Again,
how do
nobody
you?
has come up with following what I suggest. Nobody's had a new kidney stone. There have been a
Okay.
couple of people I've worked with a history of kidney stone, and then if it's the calcium oxalate kind of kidney stone,
Mhm.
then I don't know. There's some discussion about that in this world about offsetting that with the potassium citrate citric acid supplement that can alkalize the urine and make that less likely to happen. But I look at it from the nutrition point of view, which is that you want to lower your intake of oxalic acid,
Mm-hmm.
oxalates, and that would be being really careful with the things that are high in oxalates, like spinach. People
Okay.
gravitate towards spinach, high in oxalates, or
That's right.
out of all the nuts out there, they like almonds, high in oxalates.
Right.
So, I guide people towards the better choices there, and just a heads up not to ignore any symptom and to stay really well hydrated.
Okay, cool. And then I know that we need protein. We mentioned that a little bit and how important it is, to
Yes.
maintain your muscle. Um, and so, do you have clients that come to you who also are vegetarians, where it's a little harder to get the adequate protein in your diet? So, how do you deal with that? Because uh, it seems like that would be difficult. I mean, even the diet doctor has a whole, you can do low carb as a vegan or vegetarian. They also have a section that does with, low carb, high protein. So that's kind of a new thing that they're doing
Mm-hmm,
on the
mm-hmm.
website. But so how do you deal with this protein question where you don't want people to kind of lose that and they're vegetarian? I mean, how do you, or, just that kind of question?
Yeah. So that when we talk about things that, comorbidities, that's almost in my mind. It's not a comorbidity for real, but it's an unnecessary restriction that people put on themselves. So
Okay.
that a vegan or vegetarian diet is a choice. It's not mandated.
Hmm.
It's not like you have a condition and so you can't eat the meat.
Hmm.
And I understand when people, tell me that, for ethical reasons, they don't want to harm animals. I get it. I understand. These are, fellow sentient beings, and I get it. But on the other hand, cancer doesn't care what your
Hmm.
politics are, what
Right.
your ethics are. Cancer doesn't care about any of that stuff. So um, I will put it out there that
Hmm.
adequacy of protein in the diet. So a keto diet for cancer is only adequate in protein. It's not super high in protein.
Hmm.
And that's because, like I said before, the cancer can use those amino acids as well.
Hmm.
So we keep them low but adequate. And the best way to do that is with animal sourced proteins.
Hmm.
Um, Vegetarians are not that hard to work with. I think their diets end up being a little boring.
Hmm.
So I will try to encourage people to incorporate fish if they don't want to eat animal flesh. That's
Hmm.
okay, but maybe they'll eat fish in addition to what they're doing. Um, but vegans are really tough because then if you're eating enough of the plant foods to get the all the essential amino acids that you need, then you are probably not going to be in deep ketosis. Maybe you're not even going to be in marginal ketosis at that point.
Right. Okay.
Unless you're using protein powders, and that is not an ideal. That's an add-on. That's not something that people should be relying on. So I do, especially for vegans, I really like them to use that chronometer tracking tool because it
Hmm.
shows what they're, if you record everything you eat, it will show you what your amino acid intake is. And
Hmm.
sometimes when they see that they're not meeting those amino acids, or they're not meeting their B12 or their choline or some of the other things that are more associated with animal source proteins, that they'll agree to start adding some protein. So if somebody's coming from that vegan background, I hope they will accept vegetarian, and if they're vegetarian, I'll hope they'll support adding some fish. Some people just go, just tell me what to eat. This is just the way I've eaten, but
That's
just tell
right.
me because I want to live.
Yeah. Yeah.
So, yeah. And, I know there's that whole carnivore movement, and I know there's even a group in Hungary that says, oh, a Paleolithic meat and fat diet, nose to tail. Most people are not going to do that.
Right.
And their restrictions are incredible. It's like no caffeine. You can't, oh,
Right.
they had a single berry. Well, that's why their cancer came back.
That's right. Yeah.
So I have a hard time with
Yeah.
putting those kinds of additional restrictions
Exactly.
onto people.
I like the fact that it sounds like you encourage, but you'll work with people and
I'll
you'll
work
come
with
up
them.
with a path to suit their needs. And I think as long and then again, people come to us to get that nuance expertise, but we're really there to coach them and to make what would I do if it was my kid or my wife, this is what I would do. This is what I'm going to encourage you to do. If you don't do that, here are the challenges you may face, and this is how we can overcome them. I like that kind of approach. And I'm curious because you mentioned measuring things. I know when I was at the Low Carb USA conference, I had a chance to meet it's a rare sponsor at a Low Carb USA conference, right? But I think Keto Mojo was one, and they do, they have ketone measuring devices. Most of my patients just get their carbs low and they pretty much go with it. But there are people who may want to measure ketones, even if they're not doing keto for cancer. So my question is, it sounds like your patients need to monitor ketones in order to make sure they're in ketosis. Is that like a really tight monitoring process that you guys have? How does that work for you guys?
Yeah, thank you for asking about that. I work with clients, not patients.
Okay, that's
Yeah, yeah.
fair.
But one of my first clients was my cousin Cleve. I brought him up at the meeting. He was diagnosed with pancreatic cancer in his, I think he was maybe 73 when he was diagnosed. And he had seen what the diet had done for my son, and he reached out to me, told me what was going
Hmm.
on, and asked, asked for some direction and guidance. But he didn't want to do any weighing or measuring. And Cleve had been heavy his whole life. And so he was used to diets, including the Atkins diet. So we just decided to make it more of a kind of a modified Atkins diet. So he kept his carbs low. He knew what that meant as far as what foods. He was a smart guy. He knew what that meant as far as what foods to eat. But he didn't like add fat. He didn't like make a point of adding fat. And he ate what he wanted in protein. And
Hmm.
he was told it was going to be 6 months, and he lived like 21, 22
Mm,
months.
wow.
So he did amazing. He was also doing the chemotherapy along with it, but he had an amazing quality of life, and that's what he wanted. He didn't want to be tied to the clinic. He
Hmm.
wanted to go golfing with his friends, and he wanted to go to. He had a winter place. They had a condo down in Florida that he wanted to go to in the winter. So he didn't really want to be tied to all of this. He didn't want to. He wanted to get the most out of what time he had left, and he did. He had a great quality of life until that last maybe month and a half. Um, so yeah, as far as I can just offer so much more support if
Hmm.
people are monitoring. If
Hmm.
I know that their glucose is spiking, I can help them with that. If I know that their ketones are not showing that they're in therapeutic ketosis,
Hmm.
sometimes I can help that. I can't always help that. It depends on why they're not in therapeutic ketosis. But we can shape things. So if they put in just one day on a food tracker for me, one full day, I can look at that and move things around for them and say, you could do this here, you could move this here. Listen, why don't you have the fat and fiber first? Have that half an avocado at the start of the meal, because even just changing the order of foods can
Mm,
reduce the glycemic response. So on the
right.
other end, you're finished with the meal. You understand that, and one of the ways that people can understand it for themselves is to wear a continuous glucose monitor.
That's
So I
right.
always do the Keto Mojo because I want to see what's going on in their fasting
That's right.
times. So, first thing in the morning, if they're doing time restricted eating, then right before their first meal, and then again at bedtime. And we do that for at least a few weeks, and we get a sense of what's going and what we can change.
Hmm.
And then, at some point, if you want to, like on the other side of your treatment, if you want to liberalize what you're doing, wear that continuous glucose
That's
monitor.
right. That's
The
right.
problem is getting one
Yeah.
prescribed,
It's
because
still,
they're still prescription,
that's
and
right.
people with cancer have a hard time, unless they
Yeah.
also have diabetes,
Right.
getting it prescribed. But there's an increasing number of workarounds for it.
And that's why I think Dr. Eric Westman, who was also at the conference, talked a lot about, seems like, maybe every third or fourth speaker, he started talking about research, right? So I think the more research we do, and I'm hoping to start some research myself in the next year,
Oh,
the
good.
more we'll be able to justify things. And, in the conventional world, we follow guidelines and things like that, even though I don't really, not so much anymore, but we're kind of, tied to that. And if we deviate from the standards, we're considered, quack doctors. So the best thing is to try to move the needle where we're able to, prove that these things work and that they're beneficial. So I think that that's kind of an angle I'm always interested in taking. And, you mentioned, we talked a little bit about vegetarian, vegan versus, those who do low carb and, maybe they don't get enough protein. Another thing that vegans may miss out on is dairy. And I know dairy can impact your body in some cases. So is there any concern about dairy for the patients that you treat, or should I
Yeah,
say
you bet.
clients? Yeah,
Yeah. I'm concerned about dairy proteins because if you think about what dairy proteins, where they're coming from a cow, right?
right.
Or a sheep or a goat,
That's right.
dairy proteins. But what are they doing? Why are they making those proteins in their milk? It's so they can grow their baby animals into big
That's right.
animals quickly.
That's right.
So a lot of anabolic potential in
Mhm.
dairy. So there are studies, there is the research and the science that shows that the dairy proteins, whey and casein, can stimulate a release of insulin that's not tied to
Oh, yeah, I've learned that
glucose.
too.
Yeah.
Absolutely.
Yeah.
Yes,
So
I've
normally you eat something that has glucose, so your sugar rises in the blood and the insulin is secreted to move that glucose out of the bloodstream.
that's
You
right.
don't need that glucose step in there. It's just secreting this insulin because it's sensing that there's an anabolic potential, a growth potential
Mhm.
here. Well, if you go back to what I said about all those insulin receptors on the cancer cells, they're going to just grab whatever glucose they can. So actually, and I've seen this with my continuous glucose monitor, when I've eaten cheese, I can see a drop in my glucose instead of a rise in my glucose
That's
because of
crazy.
that secretion. Yeah.
Yeah,
So, so that's dairy proteins. So I don't tell people not to have them. I just say, let's moderate the use of it.
that's
So
right.
a
That's
half
right.
an ounce of cheese has a yield of about 3 grams of protein. So 3 grams of protein doesn't move the needle for most people as far as
Right.
the
Okay,
insulin goes.
cool. Okay.
So enjoy it with a meal. But dairy fats, now that's a whole nother ball game. Because
Mhm.
again, where's this stuff coming from?
Right.
It's primarily it's coming from a cow,
That's
and
right.
those cows have been sort of genetically selected to make a lot of milk. Dairy cows are so different than animals that are raised for their meat. So this estrogen is at a high level in the milk that they produce and in the cream, maybe not so much in butter or maybe not at all in ghee because of the transformations that go on. But you have this potential of estrogen, and in a hormone sensitive cancer, not so great to have high levels of estrogen because those estrogen receptors, or even in guys in prostate cancer, it's a hormone
Mhm.
sensitive cancer.
That's right.
So these hormone receptors can respond to that. And I think even some types of non-small cell lung cancer, and even there are a couple of types of brain tumors that may be sort of hormone sensitive. So I don't like to see dairy relied on exclusively. Like, yes, it's great, all that butter, all that, ghee, cheese, whatever people think, oh, cottage cheese, cream
That's
cheese, whatever, just in moderation. I don't
that's
think
right.
there's much of an issue with cream cheese, very low yield of anything,
That's
really.
right.
It's mostly
Yeah.
guar
Yeah.
gum.
Right.
And sour cream, for some people who are having trouble holding weight, that seems to help. And maybe it's because of the estrogens in it. I don't really
That's
know.
right.
I
That's
don't know
right.
how much is in sour cream.
That's right.
But I just I have what I call dairy be wary.
Right.
You know,
That's
the thing that floats out there is, oh yeah, dairy causes inflammation. I'm not worried about that. I don't think that's true for 99% of the people. Or somebody will say, oh, I'm allergic to dairy or I'm lactose intolerant. Well, if you're lactose intolerant, cream's not going to bother you. Butter's
right.
not going to bother you.
Exactly.
Ghee's not
Right.
going to bother
Right.
you because there's
That's
no
right.
lactose in it.
That's right. They took it out. That's right. In the processing. I learned a lot about that. I keep ghee. I even have another sponsor at that Low Carb USA was Keto Chow. And they have a product, and what I do is I keep these products handy when I can't get, like, I don't have a problem fasting, but if I feel like I need something, I may do a little protein powder just to kind of get through the day. I love fasting, so most days I don't even have to do that. But it's just good to kind of be aware that
Yeah,
that's
and that's like I said, I'll eat it because as far as I know, I don't have a cancer. So,
right, right,
but yeah,
exactly,
but I
exactly.
do like that's the place where I do say to people, I would prefer that you use a vegan protein powder if you're
That's
going to use
right.
a
That's
protein
right.
powder.
That's
Yeah.
fair. I like that. And you have options, and which is really the key. And one more thing I wanted to ask, kind of like in the vegetarian space, is this ideal about plant-based burgers. One of my favorite things on the planet, and shout out to all the cows who sacrificed for me, but I love burgers. Obviously, I do a bunless burger these days, but I'm curious. Do you feel that a plant-based burger is a reasonable alternative? What's your thoughts on that?
I would put it at the bottom of the list of reasonable. I mean, I have a slide in my presentation where I compare the Impossible
Yeah,
Burger, I guess it is, to
that's right.
beef. And there's
Right,
21 ingredients in the Impossible Burger or Beyond Burger or whichever one. They're all, basically the same. Okay. So that's a highly processed product that doesn't really, it's a food product. It's not really food. It's not whole
right,
food based.
right,
So it's
right,
like I compare this to the beef and it's like, really? What do you want to put in your body, these
right,
21 different
right.
things here or this beef?
That's right.
And we're not talking, you said burger, you know 6 ounce 4 ounce burger
That's right.
maybe.
That's
We're
right.
not talking about 14-ounce ribeyes like were
That's
served
right.
up to the carnivores at the low carb USA conference. But reasonable amounts of beef, it's not inflammatory
Right.
and it's more readily digested than some of the 21 chemicals that are in the Impossible Beef or
That's right.
burger.
Right.
The Beyond Meat guy graduated. He was an alumni of the same college that I went to, and
Okay.
he gave the commencement address this year. And I was furious when I
Mm.
saw that because to me, when I read through it, it was like an infomercial
Oh,
for
really?
his product, and I felt like he was preying
Uh,
on young people, just impressionable, going out into the
that's
world,
right. That's
and
right.
yeah, and that's where that's where it's coming from. The
Yeah.
food industry, of which he is
Yeah.
a CEO of a very successful company, but it's a food industry, and
Yeah.
they are running our lives in the junk food, in the processed food, but it's like junk food, and it's also, and you look at these vegan products. If you want to be vegan, have have the nuts and the seeds and the things
That's
that
right. That's
are
right.
health
That's
building.
right. Eat that.
You know,
Eat real food.
yeah, eat real food, real
Yeah.
food.
I think
Yeah.
that, and it
Sorry,
is
I'll
a
get off my soapbox right
yeah,
now.
it's okay. I mean, it's frustrating because, even when I think about regenerative farming and you raise cows ethically, it actually reduces the carbon footprint,
Absolutely.
puts
Yeah.
the carbon back in the ground versus in the atmosphere. And if you make these Impossible type burgers, it actually does increase carbon in the air. So people, it's misinformation. Now, clearly horribly done factory farming is not ideal. We already know that. But the key is, let's not say that all beef is bad because that's just not fact. So I think it's important that I always tell people follow the money. So when people have an opinion,
Yeah.
like if you look at a research article, that's why I say you want to be able to read an article, and if it's a randomized control trial, or even if it's epidemiological, who's in the study, who sponsored it, follow the money first, and then you'll at least see if there's bias. That doesn't mean the study is not valid, but you'll at least know there's bias, and then you listen to what's being shared. So I just think that I agree that we need to live in a world where we can be honest, and I should be able to stand next to a vegan and next to a carnivore and have an intelligent discussion about what the science says and why it would be beneficial to go in any of those directions.
Oh, I know,
But
but there's so
I
much.
know it's too much emotion. It's like politics and it's like sports teams, but we have to be able to get to that point. That's why metabolic health is starting to be kind of a better way to approach these conversations. But we should be able to say, hey, what I just said. Yes, it is true that an Impossible Burger may put some carbon in the air. And if then you want to argue that that's still better than factory farming, we can have that conversation. I think that's reasonable. Then I may argue, well, let's do regenerative farming, and then that's a more sustainable approach. But the key is that we can have this conversation, and we are missing the forest for the trees. And that's why the next question I want to ask you briefly, we're both, I've been privileged I'm in school getting nutrition training. You've done it. We both understand that they use the term balance. We both understand that they say fiber, 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 fiber. And we know that there's sources of fiber we prefer than other sources. So my question is, how do you reconcile, this balance question, and how important is fiber in our diet as it relates to cancer?
See, and that's another, you look at the conflict between vegans and carnivores. The extremes in the carnivores say, no, we don't need any fiber at all. And the vegans say, well, we got to have 60 grams of it a day. And really the truth is somewhere in the middle. I do believe that healthy gut microbiome results from more than just the meat intake or the vegan
Right.
fiber. You gotta figure out what's going on. We know that there's that BDNF that
Yeah,
you have a healthy gut microbiome, and there's communication there between the
that's
gut and the
right.
brain.
That's right.
So fiber, it just makes me crazy when I see that. It's like, oh yeah, you need a balanced diet, healthy whole grains. And what are the healthy whole grains there for? They're there for the fiber.
Hmm.
But chia seed has fiber.
Right.
Flaxseed has fiber. Diet Doctor has a bread that's made with, it's called their nut-free bread or whatever. It's coconut flour
Mhm.
and psyllium husk. And some of my
Right.
clients really like that
That's
bread.
right. That's
Yeah.
right.
So you can get the fiber. It's not coming out of the grain. So
That's right.
can't they open their eyes and see when they're talking about fiber, it can come from something other than the healthy whole grain.
That's right. That's right.
Yeah. And the
And it's
same thing with nutrients. They say, oh, it's a keto diet doesn't have enough nutrients.
right. Right.
But if you do something like chronometer, you put your day in there and you look at it and you go, I'm a little short here, or am I, a little over here. You can make those kinds of adjustments
Hmm.
to what you're eating. And again, it comes back to the well-formulated ketogenic diet.
Absolutely.
So, omega-6, omega-3, that's another important thing. High-fat diet. And if it's coming from, soybean-based mayonnaise and corn oil, not a good plan. But
Hmm.
if you're making sure you include enough of the omega-3s, those anti-inflammatory omega-3s, and again, reducing the omega-6s, the inflammatory omega-6s, is just as important as increasing the anti-inflammatory omega-3. So it comes back to what I said before about sometimes it's just about what you take out of the diet.
That's right. And speaking of taking out of the diet, my last question before the last question is, when I was at the conference, I had the privilege of walking up to the mic to ask you a question. I mentioned Martha Tenenbaum, who wrote a book about using intermittent fasting as a way to help with the chemo process and the symptoms. So, what role does intermittent fasting or fasting in general play in the treatment of cancer?
Yes, thank you for that question too. God, we could talk for 3 hours, couldn't we? There's just so much out there that
I
we could
know.
still cover. Yeah, so I know Martha. I've had many conversations with her, and we both have a protocol for fasting around
Good.
chemotherapy.
Good.
Neither one of us is pushing that you can only do fasting water only. So we
Hmm.
both have a modified protocol, and both of them center around bone broth. But you can use vegetable broth if you are not into using the
Okay.
bones.
Okay.
But the Valder Longo's done some great work around fasting around chemotherapy, and he developed a product. The product that he developed specifically for cancer, it was supposed to be out a couple of years ago, but it had some problems, and I don't know where
Mhm.
the status of that is right now. But a lot of people in my world are using his Prolon product. But if you look at the Prolon product, it's proprietary, as I say, but it's, it's not, exclusive to, you
Hmm.
can take those same foods, better quality foods, actually. You can make your own broth, or you can buy some bone broth, put some ghee in it, salt it, and then maybe supplement with some, ketone supplement, or maybe with an electrolyte supplement.
That's right.
Uh, but the science is there. Thank you, Walter, showing that there is a greater response to the, for a while, let me back up a little. For a while, it was just about alleviating the GI symptoms primarily of the
Hmm.
chemotherapy. So people that did this fasting around the chemotherapy, whether it was water only or with this Prolon product, were experiencing fewer side effects from the chemotherapy, GI side effects. But he did a study more recently. It was in the Netherlands. It's published. And he was looking at two groups of women, women with breast cancer. These women were following their normal diet, and these women were fasting with his product around their, whatever product it was, around their chemotherapy sessions. And the women that were using his product fasting had better outcomes. So that was the first time that it looked like better outcomes. But I have a problem with his study, and I brought that up during the conference too, in that the group that was going through the using his product were not using dexamethasone, the steroid drug.
Hmm.
So the women that were in the control group were taking, dexamethasone, sometimes as much as 16 milligrams of that stuff. That's going to raise your glucose. So
Yeah.
I see that as a terrible confounder in his study. I'm so disappointed that he allowed that to be. I am all on board with not having to use the dexamethasone. Again, dexamethasone suppresses inflammation, but
Hmm.
if your inflammation isn't there, or is less, there's less inflammation, then you need less of something like that, or maybe none at all. So, but at least we're on the right track with
That's right.
looking at
That's
this
right.
and getting this evidence behind us. And yeah, it's Martha did it for ovarian cancer,
Hmm.
and she sailed through her treatments
Hmm.
in a
That's
way
right.
that people who are not supported in that way are, they're just having a horrible time with it.
That's right.
So
That's
yeah,
right.
so more power to her for getting that out there. and
Yeah.
and as we know from having Steve Phinney at that conference, Dr. Phinney,
Yes.
he is not a big proponent of fasting because of the degradation of muscle
Hmm. That's
and
right.
a few other pathways that he goes into. Um, and so when you come to a chemotherapy session, you're already in ketosis because you've lowered your carb intake. So now you're in ketosis. You have a head start on the whole
That's right.
muscle degradation thing. You're not
That's
going to
right.
lose as much muscle mass if you've already adapted to ketosis.
That's right. Nice. And I think again, nuanced. You got to look at a lot of different factors. Nice to know that we'll have options for people. They'll look at pros and cons, just like getting a vaccine. I mean, you look at the pros and cons and you make your decision. I mean, it's not, everybody's an adult, so we make our decision after we get the information. So we just need pioneers like yourself, Martha, to kind of help us
Well,
in this
and I
race.
could tell you what is not helpful in the chemotherapy infusion rooms is they have a refrigerator there, and quite often it's stocked with Ensure and Boost because they don't want
Mhm.
people with cancer to lose weight. But all they're doing with those products is feeding the cancer cells,
I know
just
that's
feeding the
it.
cancer
Just
cells.
sugar, sugar, sugar.
Yeah,
Anybody watching, just look at the ingredients. Look at the. It's embarrassing even
it is
to talk about
embarrassing.
it. And look at the carbs. Look at the ingredients, and you see sugar everywhere in multiple forms. So I've looked at those bottles, and we have a long way to go. And even though we were both, I am being trained, and you were trained in nutrition. The nutrition professionals create the menus for the hospitals. And of course, they're just following the guidelines, but it's horrible. I mean, I have patients who, they're getting potatoes, they're getting bagels, they're diabetic, they're getting juice. And it's like a diabetic diet at the hospital. So we have a long way to go, but
Mhm.
we'll get there. So, and speaking about a long way to go, we want to keep you healthy, we want to keep you around. So, as you think about your next 6 to 12 months, and you think about my Nest and Rope acronym, nutrition, exercise, less stress, more sleep, positive thinking, avoiding trauma. The rope talks about relationships and avoiding organisms and pollutants, and making sure our emotions serve us, and that we have life experiences that we hold on to that serve us. When you think about that, all of those things, do you have certain areas you're really focused on? Like I'm doing the whole Ben Bokiki
I am
exercise.
focused on all of it.
All of them. That's
All
right.
of it. And
Right.
incremental changes. So,
Yeah,
hopefully I get more of a handle on my sleep. Hopefully I get over this next 6 or 12 months, I get better at managing my stress. I can always make improvements to my own nutrition. I'm always looking at ways to modify recipes as I learn things. I didn't stop learning when I
that's
got my
right. Oh,
degree.
that's right.
So, and my clients all come to me with so much other
They teach us so
information.
much. They teach us
Yeah,
so
they
much.
teach us
Yeah,
so much. Exactly. I
that's right.
learn from every person I work with. I learn something. It may not always be nutrition, but I learn something about being a person from every person that I work with that has cancer. So yeah, I can't separate it out. And when I talk to people, I talk about it in that way. It's like, okay, what I'm here to help you with is to get you up and going with a keto diet, get you on the right track. But that's only a part of it. So low carb and keto is at the core of it. But you also have to look at these different fasting strategies. So you have time restricted eating. You have fasting around the keto, around the chemotherapy. Maybe even a short water only fast. Then you have like the ketone supplementation. And how do we do that? MCT oil is one
Right,
way to do it, kind of making your body do it more naturally. And then there's these ketone supplements that I feel more
right.
confident about. Then there's the fitness component. And
Gotta do it.
a metabolically healthy muscle, weight trained, yes, is going to pull nutrients into it for
That's right.
repair and maintenance and growth. And it's going to make that less available to the cancer cells. And then there's all those healthy habits. I knew none of that stuff.
That's
It's
right.
kind of good that I didn't when I was at school, because I was quite often up till like 1:30 or 2 in the
Right.
morning getting my
Probably would
work
have
done.
stressed you out.
Yeah, yeah. But I don't have that pressure now. So all those healthy habits that we've learned about with, like if you look at circadian rhythm or you look at blue light in the evenings. I used to think it was great. I'd go to like grocery shopping at 9 o'clock at night because there was no one there. Well, like it's like, woo, you're getting all that blue light in your eyes when your body should be just calming down. So now if I have to go out for something, like I put my sunglasses on. Why
That's
not?
right. That's
Yeah.
right. I love it, and I appreciate because I'm kind of like you. Let's work on all of these things, and I think they all matter. They all make us better, and again, we're constantly learning. Like I said, I wasn't doing exercise like Dr. Ben Bokikio suggests until I interviewed him, and I tried it, and I love it, and I hadn't heard of it. And high intensity training with bands and total gyms, and I love it. Twice a week, I'll do that. That's easy. So I got a lot of my patients moving in that direction because a lot of them struggle to do it. So, but thank you, thank you, thank you, thank you for sharing
Thank
the
you
story
for
about
having
your
me.
son and being here and letting me, kind of become a new friend, and looking forward to kind of keeping in touch and doing this work together. So thank you
Yes.
so much for being here today. Okay.
Thank you.
Absolutely. So today, guys, this is a very, very important episode. If you have somebody in your family who is dealing with cancer, concerned about cancer, maybe have a family history, this may be a good episode to share because it'll provide hope. And a lot of times that C word, it scares us. And I
Mm.
actually love the fact that our guest was able to suggest this is not replacing conventional treatment. We're working in partnership with our conventional docs, and they're going to help us to, augment that treatment with something that may make it better. So, and the other message that I'm kind of hearing from you sharing your story about your son is don't depend on conventional medicine as well.
Exactly.
If you depend on it, you may find yourself hopeless. And many of us had to leave our conventional thinking and think outside the box. And I kind of talked about that when I talked about the mitochondria in my lecture with Low Carb USA. It's all about, I have a problem to solve. The traditional things are not working. And I either, go to a functional medicine doctor, I either go to PubMed. I need to find something that's different, a different path. And hopefully people who are listening learn that, lifestyle is probably the best cure. Food definitely is medicine, and there's different ways to get there. We learned a little bit about cancer, and I thought cancer was stupid, and then you showed me that cancer was actually a little smarter than I thought. And our goal is to outsmart cancer. Is cancer really smarter than us? Probably not. We have to outsmart it. So a lot of the things that we're doing with this education is going to help us to do that. We talked about dairy, and we talked about fiber. We talked about intermittent fasting, a whole lot of interesting topics. And I just hope that it added value to those who are listening to this episode. So again, as we wrap up, I thank everybody for listening to this episode, growing in knowledge. Continue to do that. I'll continue to do my part. Miriam's going to continue to do her part, and we're going to just grow together so we can all achieve our health-related goals. And with that, I thank you again, and I only ask that as we wrap up, that you be safe, be well, and continue to protect your nest. And thanks again, Miriam, for being here with me today.
Thank you.